Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and today we will be reviewing a question which involves shoulder special tests. The question is as follows. A 55-year-old librarian presents to a physical therapy clinic with complaints of right shoulder pain for the past week that has now started radiating down the arm. The patient has severe pain during eccentric lowering of the shoulder. Upon examination, the physical therapist finds protective shoulder elevation, pain, and weakness during abduction and lateral rotation. Which of the following special tests is most likely to yield a positive result? Is it option A, near impingement test? Option B, load and shift test. Option C, Codman test. Or option D, apprehension test. So now, what is this scenario describing? This scenario is a typical presentation of rotator cuff tears. Now, rotator cuff degeneration typically occurs in patients between the ages of 40 to 60 years old. Now, repeated overhead activities, so in this case, taking books from and returning them to top shelves, causes rotator cuff damage over a period of time for an occupation such as a librarian. Now, pain during eccentric lowering of the shoulder is a classic sign of rotator cuff damage. And restricted isometric tests yields weakness of abduction and lateral rotation or external rotation. So again, we now know this patient presentation is describing a rotator cuff pathology or a rotator cuff tear. Now it comes down to, okay, well, which of these special tests is indicative of a rotator cuff pathology? So was it option A, the near impingement test? Well, the near impingement test is used to identify supraspinatus tendinitis. So at this point, we can cross off option A. Or was it option B, the load and shift test, which is really used to identify shoulder instabilities? So we can also cross off option B. Now, which of these other tests is also used to identify shoulder instabilities? That would be our apprehension test, which was option D. So we can also cross off option D, which leads us with option C, the Codman's test, which is also referred to as what? It is also referred to as our drop arm test, which is in fact used to identify rotator cuff damage. So in summary, we can say that option C is the correct answer choice since our Codman's test is our best available option to detect a rotator cuff tear or rotator cuff damage. Now, let's take this one step further. What other special tests are often utilized for rotator cuff pathologies? Some of those rotator cuff tests include our Hornblower sign, our external rotation lag sign or lateral rotation lag sign, our belly press test or abdominal compression test, our liftoff sign or Gerber's test, that drop arm test or Codman test, which is what we utilized to get to the right answer choice for this question, or our infraspinatus resisted testing. Now, those are all tests that we can use to look for a rotator cuff pathology. Now, don't forget, this is just one pathology within the shoulder. You should make sure to go back and review not only these rotator cuff tests, but also all of the various special tests used to identify other rotator cuff pathologies. Now, it's not only important to know the name of these tests, but you should know what these tests are used to identify and how we can properly perform them as a clinician and what a positive test would look like. I hope you found this episode reviewing shoulder special tests helpful. Never forget, warriors, you are powerful, you are strong, you are a final frontier warrior, and you will pass. Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok. Till next time, have a great day and a powerful tomorrow. Thank you very much for listening.